You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Shelbey Arevalo, thank you so much for being on the podcast.
Thanks for having me. I'm excited to be here.
Awesome. So we've never had the opportunity to talk to someone in the dental space. And I don't know much about the dental care. I mean, I have 4 kids myself, and I just know I pay cash. So tell me how you got into it. It sounds like something you probably bumped into and what it entails.
Yes. So I am very much proudly a dental advocate, as I would identify myself, right? So I have been in the dental industry, I like to say, pretty much my whole life, because I got into it my senior year of high school. So it's really, that's what I know, right? And so because I've been in the dental industry for so long, yes, patient advocacy is something that, quote unquote, I bumped into, right? It was a passion that got triggered along the way of my journey.
And what exactly is it that made you realize that there was a hole in the market where people needed this kind of help?
Yeah, that's a great question, and it's something that I always remind myself so that, I keep it in the forefront of my mind because I work with providers. So I currently am also a dental consultant, right? And so I am able to see all sides of that patient experience. So I'm always consistently seeing a disconnect, right? And there is patient perspective and there's doctor perspective. And I honor both of those, right? And what my goal is to bridge the gap and to really create a seamless, happy experience, because I see so much of that disconnect on the provider side, frustrations, things of that nature. But then, we also have the patient side, similar things. And so the goal is of the nonprofit that I started is to just create trust and transparency and really just to bridge that gap and just make things more clear and convenient, really.
So what is it that the patients don't understand about the providers and vice versa?
There's a lot of disconnects that could potentially happen, right? And so a lot of it, could even come down to the person on the telephone that's scheduling their appointment, right? That is not necessarily the provider, right? And so there are so many things that could happen that unfortunately the provider will get the blame for, right? And sometimes it comes down to someone just articulating their words properly, right? And making sure that they're explaining the patient's situation properly. And I that doesn't always happen, right? You're not always going to have that qualified individual that is able to represent the provider. Sometimes you do, right? Sometimes you have a rock star team, but that team might be doing something that they don't realize is not correct, right? And so again, it just takes taking a little bit more of those extra steps, if you will, to make sure that the patient understands fully. And, the provider is a doctor, right? They are there to treat patients. They're not there. They don't know things about dental insurance, right? They don't go to school and study codes and things of that nature. So that is why I created this program, so that they could have a reliable, unbiased source.
Got it. So you're a reliable, unbiased source for both the provider and the patient. Is that what the goal is?
Ideally, of course, right? Yes. Regardless, whatever information that we say ultimately we stick with the facts, right? We stick with the facts. And so ultimately, yes, we don't pick sides. So for example, we have a patient that needs help finding a provider, right? We don't have favorite providers or anything like that, right? We get the patient's needs, we assess their needs, and we give patients a detailed list of the area that they're in based off of the needs that they have. And we give the patient, full reign to basically select a provider, and the provider can feel confident that we have that, meaning we don't have any special agreements, if you will, right, with anybody. We are built for the patient, but we are a source that can be trusted by both.
How do the patients even get in touch with you to begin with? How do they find you? And then what kind of services does the nonprofit, as the advocate side, what do you offer for?
Yeah. So we are in our infancy stages, as I like to say, as a nonprofit, right? So there is so much room for growth and potential. And I am building this program to meet the needs of the people purely. So it is purely my passion project. And it is something that it's very personally motivated. Um, and I believe that by making it a nonprofit, I, am allowing more access, right? I don't ever want to say no to any patient. And so there could be many different avenues, where they might be able to get in touch with us. I'm involved in the advocate community. If they go to my website, they're interested, they could easily schedule a consultation and get on my calendar within the next 2 days if someone wanted to. It's a complimentary 15-minute consultation. And I'm, very honest. And again, the idea is to be a resource for patients, regardless if I am able to help them in that moment, right? So the idea is we're building a platform and a website where patients can come and get resources, where they don't have to, do a Google search, right? And it's all in one safe space. And so along with that, right, there's tons of little projects, as a nonprofit that is really exciting that we get to create. And so I'm really, as I'm helping patients, I tell them that they're helping me. As I'm helping patients, they're helping me build this program, right? And so I'm all ears, right? What is it that patients need, right? And I'm building the program to fit that need in whatever capacity that means, right? So in California, because this is where I'm at, right? This is home base. This is where a lot of the focus is as far as doing the physical work on the ground. So as of now, I do a virtual advocacy, right? So I'm helping patients in many different states at this time, and it's purely virtual. There will be times where I may assist a patient virtually and attend their dental appointment if they need me to, right? And actually verbally talk to a provider if they need me to talk for them, right? And so that is a service that I offer. Now in California, what we're working on is trying to get mobile dentistry into these care facilities. It is a newer part of the dental industry.
What kind of care facilities?
Skilled nursing, assisted living, any type, really. Any facility that wants a mobile dentist, right? As a national nonprofit, like a human being, we all need dental care, right? And so we ideally would love to, hey, have mobile dentists for everybody, right? But the reason why we focus on that community is because they are usually they don't have the ability to have transportation, right? They have mobility problems and things of that nature. My father is physically disabled. He's in an assisted living, and I'm completely responsible for taking care of him. And you would think someone that is, in the dental industry would have an easier time, facilitating my dad's care, but he's wheelchair bound in an assisted living. I'm just like you, right? I'm a single, not like you. You're not a single mom, but I'm a single mom and I have a child and I have all these things, lots of life. And it's very hard to get my dad to an appointment in general. And you go to the dentist and they have a series of visits. I'm a dental consultant. I know how that series goes. And it's just devastating to get to that appointment. And it takes, so much leading up to that just to say you need to be referred out or come back, for another day. And here I am, I have to take off another day of work kind of thing. Right. And so I really am speaking to myself, right? As a consumer, I am who I am trying to help. So the goal is on the grounds in California is to really create this awareness, if you will, of this kind of silent creeping, like it's like no one's really talking about it. We all know that the issue is there, right? We all know that there is a lack of access. So it's like, what can we do? What can we do about it, kind of thing? And I'm hoping that as time goes on and as I'm gathering resources, right now I'm working with a provider that's in San Francisco. She's a mobile nonprofit dentist. And so right now we are working on getting her into facilities, right? But the mission will always be primarily with the patient. We always stand with the patient primarily. But we will have partnerships in order to help facilitate treatment, if you will, right? If that's what the patient's request is.
So is that the number one thing that you're focusing on advocacy? Like, when are people calling saying, I just don't have access to care when they call you and schedule these consultations? Is that
There are so many different requests. I mean,
so tell me a little bit about what kind of clients you're talking to. What are they asking about? I think it's great that the mobility is a piece of it, but it sounds like that's actually not the biggest slice of the pie when it comes to the people who are inbound coming to you.
when it comes to patients that have the ability, because here's the deal, the whole point of my nonprofit is to be a voice for the voiceless, right? And so as of this time, I am getting clients that I would say, I'm a national nonprofit. I'm always going to have my doors open to everybody. So you have a dental concern, you call us and we can see if we can help you. Anything from a bill, right? You have a question on a bill. If you would like a second opinion on a treatment plan, coding questions, right? Billing questions. As a billing specialist, I have access to the national basically what doctors are allowed to charge. I have those numbers. So we make sure that patients are being overcharged. And there are patients that have oral maxillofacial pain. And for example, I have patients that I'm working with and they have not been able to get help for over 15 years. They've seen over 30 providers and they just keep getting the runaround and they're in excruciating chronic pain. And they just need help and there's no one there to help them.
Why does that happen? Why does somebody see 30 providers in 15 years and no one can help them with their pain? Why does that happen in the first place?
Well, I think a lot of it is because now that I've been this patient's advocate for going on 3 months, I've seen firsthand, and I think a lot of it is, to be honest, fear and just not knowing the unknown. And so a lot of providers, I feel like, are seeing this patient's case and they get scared and they don't necessarily know. And so instead of saying that or giving the patient resources, they just refer the patient out. And so the idea is those patients, because this happens every day, all day long, can come to our nonprofit and we can hopefully be that missing piece for them. That's the hope and the dream. And they get that personal one-on-one help right? These poor patients, it's not even finances aren't even an issue. They just want to get out of pain.
And so with a situation like this, I think it's a nice case study for us to jump into. What would you do? What are you doing? And how does that affect their outcome? I mean, what does it actually look like on a day-to-day basis with them?
Sure. No, great. Yeah, great question. So with the way that I've designed the program is to make it, like we're just kind of like a lifelong partner, right? So she's enrolled in our membership program. It's $35 a month. And so basically what that enables her to is discounted services and services within that membership. So that'll include 2 advocacy calls, whatever that may be. It's 2. And again, you're getting discounts, and hopefully in the future we have partnerships where we're able to give patients a welcome kit where they have free goodies, right? That's the idea, free dental goodies. And so in particular, right, when we have these patients that are more complex, the idea is we get funding where I don't have to charge patients. The idea is I don't feel like patients should have to pay for this, right? Patients shouldn't have to pay to just get help like this. So the idea is to get funding so that this can be paid for. But that's, we're in our infancy stages. And so a patient like, the ones that I have will, when it comes to a complex case, it has to be done in phases and stages, right? I don't overpromise. And I am always completely transparent as far as
What are you actually doing? Are you doing the research and like crossing off if it fits it with this? Is it?
Yep. So with this case study, and she's given me permission to talk about, right, everything she's given me permission, and she is in a lot of help. She really wants help, and so she's willing to share her story. And so yes, with patients that have complex cases, as an advocate, I need to first I have to figure out, okay, their shoes, right? I have to really get a good idea of what's going on. And so with her, it's a lot of researching. It's a lot of trial and error, right? So I've now sat with she's been through 2 provider visits with me, and one just completely canceled her on the way to the appointment. And it was almost like I gave them too much information. So here I am as an advocate thinking I'm doing the right thing, but I'm transparent with my patient, and I'm like, okay, we're going to have a new approach, right? This was not the right approach now. And so that's what I mean by trial and error. So, as a patient on the receiving end, when we have these complex cases, they're, she's wonderful. She's great to work with. She's patient, and we just take it a day at a time. And so right now we're going through basically providers in her area and going through the list. And so this week for her, I'm working on a new area of providers' offices, basically that she's given me the green light to research. So I have a list of providers to research. I will call these offices and basically give them just kind of like an idea of the patient and the needs, and basically figure out if they may potentially be a good fit. And ultimately, I gathered the findings that I have, right? I put my dental consultant eye on it too, right?
And what
They have a website, right? What are all the things that are patient-facing, patient value that I would think, hey, that's going to be a great fit for that patient, right? And I will compile this all for the patient. And, if it needs to another consultation, sometimes it needs that, right? With this particular patient, I've spent hours on her case, and most of it is donated time. There are times where, with her specifically, there are charges per hour, like $150 an hour. That is the highest fee, because she needs, anyone that needs me to be virtually there.
it sounds like people come to you, they're finding you in different ways. You're figuring out how people are finding you because it's still a new entity.
Yeah.
And then they come to you with problems. So sometimes it's a billing or an insurance problem. Sometimes it's being turned away by providers. And sometimes it's that they feel like the treatment plan that they've been recommended doesn't quite align with what they were hoping or wanting, and they're seeing if there's another option or another way to handle the problem. And because of your vast experience in the dental field, you're able to either say that is actually the best course of action, or you know what, you haven't been presented necessarily with all the options. Let's go over what you can do. Is that kind of how it works?
You got it. You hit the nail right on the head. Exactly.
Talk to me a little bit about what being a dental consultant looks like and how that is also informing you on the advocate side.
Yeah. So I feel like that's really what gives me my advantage, if you will. And I feel like that's why I have such a strong foot in the door. And I just am so passionate because I am living and breathing it every day. Right. If I'm not patient facing, I'm actually in these dental offices, and I have now taken this board certification, and it's board certified patient advocate, and I'm making it who I am, right? I'm making it part of how I walk this earth. And so I go into these offices and I'm preaching, I'm practicing what I preach. So we're making sure that systems are set up ethically. We're making sure doctors are charging patients properly, and transparency is key, right? That's it. Transparency is key. And just giving patients that 5-star service. And I'm always coaching you treat every patient like they're the most important patient of your day, right? So I definitely think it gives me a very, very big advantage, and I don't take it for granted. And I know it's a very special place that I have, and I'm very careful with that.
As a dental consultant, the dentists are the ones hiring you to come in and
Yeah,
optimize their practice, essentially. Is that what that is?
exactly.
And so you look at their marketing, their billing, patient churn. What are you looking at most of the time?
My specialty is billing specifically, so dental billing and operations.
Mhm. And what kind of problems do you find that dentists typically have with billing where you clean it up and make it run smoother?
A really big one is, just lack of having a qualified biller. A lot of it is there's a lot of missed opportunities out there. There are a lot of benefits that are not being utilized. And patients, they only know what they're being told by their doctor, right? And so a big one is appeals. There's 33% of claims are appealed. That's outrageous, right? As a dental biller, 99% of my appeals are getting paid, right? And so that's a huge thing that I teach, right? Is you don't take that as an answer. You don't take no as an answer from an insurance company.
So here's now that I'm understanding both sides, what's kind of the most interesting thing that I'm hearing from you, if I'm connecting the dots right, is really the doctors, the dentists, and the patients are more aligned than either of them think. The dentists just simply don't know how to take advantage of the insurance that the clients are already paying for or receiving. And so they can't inform the patients or even bill them correctly. And so they're left either not getting the services that they want or not being or having to pay out of pocket for them. Meanwhile, the patients aren't getting the kind of care and options presented to them that would make it an easy yes. And so in informing both parties, you're trying to make dental care more accessible for everybody without stiffing the dentist, because they can actually get reimbursed by the insurance for a lot of these services that they want to provide for the patients. Am I understanding it correctly?
Exactly. Perfectly. Yes.
Okay.
Exactly.
So that's interesting. And so I think because you have that specialty in billing and coding and understanding insurances and appeals, you appeal to both of them, because it at the end of the day, like if it increases the dentist's bottom line as while simultaneously increasing client satisfaction, patient satisfaction, it's like a no-brainer win.
Got it right there.
And so the patients are also obviously happy. Do you feel like there's room in the market nationwide for more dental advocates? And if so, should they be specializing in billing and kind of learning that part of the business.
Oh, 1,000%. I have not even started. I haven't done a drop of marketing. Everything has been strictly referrals, and I have a waiting list right now. So to say there is a need, that's an understatement. And so the hope is I create this nonprofit and I get to have more dental advocates, right, that work for us. And we're this awesome hub, right? And we're this go-to. And the idea is we're just here to be of service. My dream would be to be an add-on to other advocates, right? Like we're, because dental is such a focused group, right? And I know that there are some patient advocates that are just doing incredible work. And, that's not to downplay what I'm doing, but I know that there is a lot of incredible work that's being done out there. And I would love to just be an addition to that if there's a dental need that their patient needs. And the hope is hopefully that it's completely funded one day.
Right. At least your side of the service for the patient so that they can actually get access to the service.
Exactly.
Right.
Yep.
How long do you think it would take someone to learn enough to become an advocate with this dental specialty?
When it comes to advocacy, for me, it was such a natural thing. And I feel like a lot of the advocacy groups, like the peers, it's like who you are. It's like who you are as a person, right? And so I feel like that's first. And it's just kind of something that you're born with, right? And the rest comes after. I believe that, anyone can really learn this if you care enough. The coding is very hard. That's something that I've learned over 15 years of experience, right? That's something that I continue to go to schooling for and get certifications for because it's constantly changing. But I really think that even a lot of people that work in the medical field, if you can just tweak it a little bit and you can, apply that to dental. So there's definitely a lot of potential.
When you say in terms of the coding and understanding the ins and outs of the insurance and taking courses, what kind of courses and what kind of certifications are you taking? And is it unique to dentistry?
Yeah. So I'm currently really into medical cross-coding. So the idea is, a lot of these doctors, dentists, they are not comfortable billing medical insurance, right? Which I get it, right? But if we get comfortable and we tap into that, that's a huge, benefit for the patient. So those are additional courses that I am taking. So I am a sleep apnea billing specialist. Sleep medicine is something that I'm very, very passionate about. And so again, a patient just has a slight inkling of, I think I'm having some issues with my sleep, right? I have insomnia. Let's call, maybe I need some help, right? Maybe it's oral health related. You call us and we can literally help patients navigate that whole system. I have a case study that just successfully got his CPAP, and now we're working on potentially getting him an oral sleep appliance. So it's just the best, greatest feeling to be of service to patients like that.
And what are these courses that you take? Who are they really designed for? Because they're not designed for advocates by nature because the advocacy is so new. Who are they really designed to train?
A biller. They're designed for a biller specifically. Yep. It'd be billing specific advocacy. But right. It's for the biller. That's what the course is for. So there's courses like through the ADA. I always, it's pretty reasonable. It's a generalized course, but it's going to cover all your basics, and it's coming straight from the source, American Dental Association.
And do you feel like if an advocate, maybe they have experience as an advocate, maybe they don't, but they know they want to do this and they have a passion for dentistry, would you recommend them taking a course like that?
Absolutely.
Okay.
Yeah.
Right.
Absolutely.
And do you see this? I know you said it's national. Do you see yourself staying in charge and hands-on with this as you grow, or is this you just kind of wanted to start it and hand it off at some point? Because I'm assuming if it gets into, let's say, all 50 states, it's going to be a pretty big beast of a thing to kind of manage.
Totally. Yeah. The idea is, of course, right. I have big dreams. The idea is I'm always going to be invested in some way, right? Of course. But I would like to create a self-sufficient program. Ideally, I would like to create a program that has more automation, right? I want to create a program that is very easy and accessible to patients. And yes, where I am not so much hands in, right? But I have to pay my dues first, right? And I enjoy what I'm doing. I really do. And as I'm helping patients, they are helping me. They are helping this program. And we're building our programs and our systems based off of these patients that I help.
Okay. If there's one thing that you want that you could kind of impart patients knowing about their own dentist, what would it be?
That he or she is more invested and cares a lot more about your dental health and about you as a person than you may think. And there is a lot that goes on behind the scenes, so much preparation and care for your visit the day that you show up. And so I just encourage patients to just give their provider a chance and to just always ask questions and to not feel like you can't ask questions, right? They need you to ask questions.
Absolutely. And if they wanted to get in touch with you, if somebody wanted to get in touch with you to learn more about advocacy, or if they're a patient and needs some of this help, is your website the best place to connect with them?
Website is the perfect place, nationaldentaladvocacy.org. Also call 707-ASK-NDAP. And yeah, that's pretty much it.
Shelbey Arevalo, thank you so much for your time. I appreciate it.
Yay, thank you so much. It was a pleasure.